Okay, good evening. All right, so today we're going to discuss a topic that I get a lot of complaints on, and it's peeing at night. So we're going to discuss what causes this, as well as some solutions to this. Okay, so I'm not going to take much of your time today. It's going to be a very, very brief session. So let's just go straight into it. Now, when someone complains to me about getting up at night to pee, they must have heard some things or some causes of this. So if I am to define what's getting up at night to pee is, it's nocturia. That's the medical term for it. Okay. If you get up once, it's not too bad. If you get up twice, it's not too bad. But then if you get up more than 2 times in one night to use a restroom, then we call that a medical condition, nocturia. Okay. So some of the popular causes that you may have heard causes this is that you have a urinary tract infection, or that your prostate gland is enlarged, or you have an overactive bladder, or that you're drinking too much water before bed, or you have some liver problems, or you have high insulin. Okay. So I don't want to spend too much time talking about these popular causes because most of us have heard this before. Okay. If you have a UTI, you should know that you have a UTI. You should check it out at the hospital. They would administer treatment to you. For enlarged prostate gland, we have talked about it in one of my previous live sessions, so I don't want to go back to it. Having an overactive bladder, we'll touch on that during the session. We'll also touch on drinking too much water before bed during the session. Liver problems, if you are already working on your liver, then you getting up at night to pee, you should fix that whilst working on your liver. And then we have high insulin. So high insulin is one of those other causes that is not talked about as often. Okay. And high insulin being that when you have high blood sugar levels, then your body can excrete it in the form of urine. Okay, so it's your body's way of trying to release that excess blood sugar by pushing it into your urine, and we call that polyuria. Okay. You can also have an irritated bladder because of high insulin. Okay, so remember, high insulin doesn't necessarily mean that you are diabetic. Okay, some people are struggling with insulin resistance. The vast majority of people are struggling with insulin resistance, and that's just the beginning phase of prediabetes and diabetes. Okay, so high insulin is one of the things, but if you live a healthy life, if you cut down on your carbs and processed foods, you eat more fats, and you eat as a human being should eat, you fast, you wouldn't have issues with your insulin levels. Okay, we have issues with insulin because we are consuming excess carbohydrates, excess processed foods. Okay, and we don't give our body time to do away with what we have stored up. Okay, so if you already live a healthy life in terms of your diet and lifestyle, then you don't have to worry too much about your insulin resistance or your prediabetes. Okay, so these are just some of the causes of nocturia. We also have uncontrolled hypertension as well. Okay, because if you have uncontrolled hypertension, your body can be trying to reduce your blood volume by pushing more water to your kidneys so that it can release some urine, and then your blood volume comes down. When your blood volume comes down, your blood pressure also comes down. Okay, so you having uncontrolled hypertension is one of those reasons that would cause you to get up at night to pee. That one is just your body's form of helping you, okay, trying to reduce your blood volume so that you can have a lower blood pressure. Okay, so I want to spend more time talking about some of the things that we are not that we don't hear. And one of them is anabolic imbalance. Okay, and this is the same thing to your circadian rhythm. So at your daytime, your body is in a catabolic state. It is mostly energizing, helping you get around your day. And then at nighttime, your body is in an anabolic state, which is the healing state. Okay, you must have heard before that most of your healing takes place at nighttime. Okay, now some people, because of stress and anxiety and the many things that a human being goes through in life, many people don't switch between these states easily. And some people stay in the catabolic state for too long. Okay, and again, because your body is trying to help you, it sends water down to your kidneys, and then it sends them down to your urethra, your bladder. Okay, sorry, I made a mistake here, not to your liver, but to your bladder. Okay, and then it causes you to want to empty out at night time. So this anabolic imbalance is one of those reasons, because sometimes it's not because you are taking too much water or that your insulin is so high at night, because your body has mechanisms in place to help make sure that you don't have high insulin at night. Okay, your body knows all these things. There are already mechanisms, hormones that have been in place to help you get a good night's sleep. So this is not foreign to your body. Okay, so some of you who are in good health, you take care of your insulin, you take care of your hypertension, you are not taking too much water while you get up, you are not taking too much water at night, you are working on your prostate gland, etc. For some people, it's just this anabolic imbalance. Okay, just your body is not, you're not in the right rhythm, and it can happen when you don't already get good sleep at night. Okay, some of you are already used to this anabolic imbalance. So for weeks in a row, you are not sleeping very well. So it's already your body already sees it as a normal thing. Okay, so you now have to work on getting your body back into the right circadian rhythm. Okay, so this is just one of the reasons that we don't really talk about. Okay, because I think when I hear these complaints of, oh, I'm getting up at night to pee, and then I ask certain questions, you always tell me that, you've tried with your not eating too late at night, you don't have any infection, you don't have any prostate gland enlargement. So simply anabolic imbalance. Okay, and we are going to discuss treatment options for anabolic imbalance. And another major reason is obstructive sleep apnea. Okay, and this is a condition where you stop breathing at night because your throat closes off when you breathe in. So when you want to take the next breath in, it's a struggle, but you don't know because you are asleep. Okay, it's usually take the next person, if the person is a light sleeper anyway, it will take the person sleeping next to you to tell you that you are having difficulty breathing. And this can happen many times in 1 hour, and they usually last about 10 seconds. So your body is having difficulty breathing, and it makes your body squeeze your kidneys to pass out urine. Okay. So how can you spot obstructive sleep apnea? You are usually waking up around 3 a.m., give or take 20 to 30 minutes difference. Okay, so it's either you're waking up at 2:30 or you're waking up at 3:30, between this 3 a.m. hour. Okay, and if you wake up more than once to pee at night, then it's usually about 90 minutes apart, which is one sleep cycle. So when you sleep for 90 minutes, that's one sleep cycle. Okay, so you get up to urinate about 90 minutes apart. Okay, and you also notice that your sleep drive goes up during the day and it's usually lower at night. So you are tired during the day and you feel like sleeping more during the day than you are at night time. So these are just some of the little ways that you can spot that, okay, I have obstructive sleep apnea. Okay, especially when you're waking up around 3 a.m. Okay, not to bore you with the reason it's 3 a.m., but it has to do with your REM sleep. Okay, between the hour of 2 to 3 a.m., 3:30, that is when you are in REM sleep. Okay, and your body, you are basically in light sleep at that point in time. Okay, so you tend to wake up more at 3 a.m. to urinate. So these are just some of the points. If you are struggling with obstructive sleep apnea, or if this is how you wake up at night to pee around 3 a.m., or if you wake up more than once, it's usually about 90 minutes apart, and then you have a higher sleep drive during the day, then you are most likely dealing with sleep apnea. Okay, and you should go to the hospital. They would help you with with your treatment. Okay, I wouldn't recommend medications to help you with your sleep apnea, but you can do other practices at home that can help you with your sleep apnea. Okay, so let us discuss some of the practical ways that you can stop nocturia. So you want to gargle salt water before bed. Okay, and if you are struggling with your weight, or you are eating processed foods and sugars and carbs, it's best to, at least limit your intake. Okay, because this will help with your insulin. Okay, because the driving force behind this sleep apnea and this anabolic imbalance that we are talking about is actually high insulin. Okay, so this is one of the reasons why your weight's very crucial, and also your processed foods, your sugars, your carbs, also very crucial. Okay, and you also have avoid sleeping on your back, or you put a towel. If you want to sleep on your back, you put a towel at your back and then you sleep, and then you try breathing in through your nose. This is a common practice that everybody should try. If you breathe through your mouth, then you are most likely to develop sleep apnea. Okay, so try optimizing nasal breathing, and then at night time, you limit exposure to blue light. Now, another way you can stop nocturia is a 5-4-1 rule. So you don't eat 5 hours before bed, you stop drinking 4 hours, and then you double void 1 hour before bed. Now, if you've never heard what double voiding is, it's simply after peeing, you leave the restroom, you do something for about 20 minutes, and then you go back to try and force yourself to urinate. The reason behind double voiding is that sometimes when you pass out urine, you do not completely empty your bladder, and it can cause you to, when your body is trying to squeeze your kidneys and more water is passing through your urethra and your kidneys and your bladder, it can get full, and then you have the urge to urinate, right? So at least if you can completely empty your bladder, then even if you have urine in your bladder, your body doesn't signal that urge to let it out. Okay, so this is just one of the ways that are very helpful, trying to double void. Okay, so you go back to the restroom and try your best to pass out urine. Now, another method that is very helpful is vitamin B12. We call it methylcobalamin. Okay, now you do not have to swallow this. You just put it underneath your tongue, about 5,000 mcg. You put it underneath your tongue. The reason is that there is a very important blood vessel underneath your tongue. Okay, and when you put vitamin B12, it helps to at least reduce how much your kidneys will function at night, help with hormones that help you sleep better, so that it would help prevent you getting up at night to urinate. Okay, now if you do not have access to vitamin B12, or the country is too hard, you cannot afford vitamin B12, or whatever reason, I have an alternate recipe here for you. Vitamin B12 would be the best. Okay, but if things are too tight for you, but you cannot get access to vitamin B12, I have a simple recipe here for you. So you just have 5 teaspoons of honey and 1 teaspoon of pink Himalayan salt. You have to put it in a jar. Okay, you have to put it in a jar, and then you cover it. But before going to bed, you just take half teaspoon of that mixture. Okay, half teaspoon, and then you put it under your tongue, and then you go to bed. Okay, so this would help at least give you similar, not the same way vitamin B12 would help, but at least similar results to vitamin B12. Okay, so you just put half a teaspoon under your tongue, and then you allow it to dissolve. Okay, so you don't use the whole 5 teaspoons of honey and 1 teaspoon of pink Himalayan salt. Okay, you're just using half teaspoon. Okay, now some of us, you will still get up at night to urinate. Okay, this is just one of the harsh truths that I want to let you know in this live session. So you would still wake up at night, even despite trying everything that I have already mentioned. It may not work for you. Okay, even if you get B12 and it doesn't work, or you try the recipe, or you do the 5-4-1 technique, and you may just still get up at night. Okay, age is one of those reasons too for nocturia. Okay, but sometimes the issue is not that, oh, I'm getting up at night to urinate. Yes, the frequency with which you get up at night to urinate matters. It's obstructing your sleep. So the less times you get up, the better. But then another issue is not just that you are waking up at night, but then how do I get back to sleep? So let us discuss some of the things that would help you. The first thing is to not look at the clock. Okay, because when you start checking the time, oh, what's the time? Oh, I have just 2 hours. I have just 1 hour. I will soon get up now. Oh, it's 3:30. I'm supposed to get up at 4:30. And then it's like, you cannot get back to sleep because you are already tensed about the situation. Okay. We also have what we call non-sleep deep rest. Okay, and this is a situation where you just lie down, there is no light, you are not getting in any artificial light, you are not looking at your phone, you're not trying to read a book. It's as if you are sleeping, but you are not. Okay, so we call this non-sleep deep rest. It helps to just calm your body because that's what sleep is for. Okay, to help you rejuvenate, right? So 1 hour of this non-sleep deep rest equals about 20 minutes of sleep. So yes, it would be better for you to sleep, but if you cannot, then just lay down. Stop worrying about, oh, I'm not sleeping and this is affecting my health. Just don't worry about all that, and that's just make do with the situation that you have by deep resting. Okay. Another thing is your heart rate. So you need about 60 or below breaths per minute for you to get into sleep. Okay. Now, from the time you get up from a sleeping position or from a lying position, and then you stand up and then you have to walk to the bathroom, it can raise your breaths per minute. Okay. Now, one additional tip that I would give you is if you don't have to get up at night, then try not to get up. Okay, so I if it's too uncomfortable for you, no problem. You don't have to try this method, what I'm about to say. But honestly, I feel like it would help. It's not something recommended. This is just, my own would I say recommendation. So if you can't wake up or if you don't want to walk, because if you think about it, by the time you go from lying to standing up to walking, and then you already have that light exposure, it's like there's already a disruption. Okay, so how about you just put something beside your bed, like a can or whatever it is. Like I said, if this is too discomforting for you, then you may leave it off. But if you just have something beside you that you can use to help pass out urine, so that you don't have to start standing up and walking to the bathroom and then checking your phone and checking the time and all that, it would help so that you don't have to, you would skip all that would wake you up. Okay. And then with your heart rate, the best way to get your heart rate down is to try the 4-7-8 breathing. Okay, so you go from you breathe in for 4 seconds, you hold it for 7 seconds, and then you breathe out for 8 seconds. Usually when you try this about 3 times, you should fall back to sleep. Okay, so these are just some of the tips, recommendations that I have naturally that would help you. I know it is a very big struggle for some of you, but I hope that at least if we try 1 or 2 things here, it would help. And I hope that I've been able to, say some things that you are not used to hearing in this session. Okay, so we are done. Please let me know if you have any questions or comments. And if not, you may leave. Thank you so much for joining me live. Questions, comments, feedback? Any questions or comments? And if there are none, you are free to go. Thank you for joining me live. You're welcome. Thank you for coming. Yes, minimizing drinking at night, but some people already minimize drinking at night. Okay. And sometimes even when you don't drink at night, you still pass out urine. Okay. So that's why I wanted to make this to have this session with you so that we can discuss other ways um that can be of help. Okay. So yes, minimizing how much you drink at night is one of the ways that you can deal with nocturia. Mhm. In another meeting, it is not safe, but can lead to stroke. Are you saying that you've heard that if you don't take water at night, it is not safe and it can lead to stroke? Mr. Jerry, is that what you mean? That is very, very false information. That is very false information. Anyways, you should have more of your water intake at morning or at your daytimes. But if you not taking water at night would not lead to stroke. Okay? You not taking water at night would not lead to stroke, please. That is false information. Okay, but what of someone who is advised to take hot water at night before going to bed? Now, if you take water at night, if that's what your doctor has advised you to do, then please stick to it. Take your hot water at night. Okay. But if you, whether or not, in some cases, whether or not you take or you consume water at night doesn't prevent nocturia. Okay. So even if I tell you minimize how much you drink at night, for some people it may help. Okay. But for others, it doesn't help much. Okay, so if that is a doctor's recommendation, I do not know if that's a doctor's recommendation. I don't know I don't see the benefits of you taking just hot water at night. Okay, but if you're advised to take it, fine. If that's your doctor's recommendation, fine. Okay, you can focus on other ways that can help you with your nocturia. Okay. Any other question or feedback? Oh, sorry. I went back to my Canva. Okay, Mr. Curtis says, my experience is that I urinate more often during the day that I do not exercise. So we would have a separate session for you. Yes, I also get complaints like this, that you frequently pass urine during the day. So we'll get to you. Probably next week I'll do another live session on the opposite of nocturia. Yes, hypertension, uncontrolled hypertension and diabetes can cause you to get up at night to pee. Yes, Mrs. Grace. Yes, I'll make the recording available. I'm sorry, my slides are no longer opening. But please let me know if you have any other questions, and if there are none, you are free to leave. Okay. Okay, the breathing exercise is 4-7-8. So you breathe in for 4 seconds, you hold it for 7 seconds, and then you breathe out for 8 seconds. So usually if you try this about 3 times, then it would help your body relax, your muscles relax, so that you can go back to sleep. Okay. So I'll make the recording available. Okay. So that if you are just coming, you can catch up. Any other question or comments? And if there are none, you're free to go. Thank you for joining me live. All right, you're welcome. So I would see you again next week by the special grace of God. Okay, and if there's any question you have, just let me know on the platform via email, or you call me and I will attend to you. Okay, so it's my pleasure being with you again. I wish you the best of health. Take care. Bye.